We're holding conversations with patients, with health professionals, and with neurological charities in relation to the impact of COVID-19 and what we need to expect in the future. This afternoon, I'm delighted to be joined by Dr. Irwin Gill. He's a consultant paediatrician in Neurodisability and Rehabilitation in Temple Street Children's Hospital. Thank you for joining us today, Dr. Gill. Can I start by asking you, what's the situation at the moment in Temple Street, in your own specialty?
In terms of the outpatient services, we have over the last number of months started to, get outpatient clinics working again. So they are certainly operating. They're operating a bit differently to how they operated before. In terms of the disability clinics, what that tends to mean is that if you're a return patient, you'll usually be given an opportunity to attend an appointment virtually rather than in person. So we'll do them over the phone if it's about checking on progress or following up on results. But all new patients would all still be seen for the first time in person. We don't think that it's a good idea to see that particular patient group virtually for the first time. So not much changes for those. I suppose what we tend to ask is that for parents who are coming in, we tend to ask the parents come with just one parent without siblings, and that people wear masks if that's possible, just to keep things safe. We all wear these our face visors when we're there as well. So those kind of practical things make it a bit safer for people to do. But we're very much back up and running, and I'm glad to see our patients back after having missed them for a good long while when things were run down. In terms of it in Temple Street, then as an inpatient piece, we're obviously we're doing obviously different things in terms of social distancing and hand hygiene and barrier stuff, as it's been well publicised in the national media to keep everybody safe, but are under some additional pressures because of coronavirus as well. And I suppose specifically related to the fact that other services outside of Temple Street have shut down as well. We as a tertiary acute hospital have remained open throughout all of this, obviously. But obviously a lot of community disability services, the National Rehabilitation Hospital, for example, shut down for a while, and that has an impact on our patient group for sure. And I think we've been busier as a result for sure. On top of that, Beaumont Hospital, which previously catered for children who needed neurosurgery, typically children with acquired brain injuries who were over the age of 6, because of coronavirus, that ward was closed to children and is now needs to be used for adults. So all of those children are now in Temple Street as well. So we are busier, I think it's fair to say, and are working differently to try and meet that need.
And that's kind of like the crisis situation at the moment. What do you envisage changing over the next few months for families and children with neurological conditions in your service?
Well, I think as time goes by, we might be seeing more children in person in the clinics is the hope as we work out ways to make that happen safely. Our waiting rooms are one of the issues right now, that we can't have too many people sitting in a waiting room because they can't be on top of one another because of the risk of infection. And I suppose one of the things we've learned about coronavirus is that in general, children thankfully don't get seriously ill with it. We've seen very little of it in that regard in Temple Street, thankfully. But keeping staff and families safe is a major priority. So I suppose that might change a little bit. In terms of our own service working, where we had before coronavirus, and will continue to advocate for, I suppose, for more help from more members of the team. So those are largely nursing colleagues and physiotherapists, occupational therapists, psychologists, speech and language therapists, colleagues in play therapy and music therapy, and specialist nursing, and indeed bed space. So I think we were short of all of those things before, and we are, I suppose, probably increasingly short of those things now. And we certainly have ambitions to develop the service more, including the evolving acute rehabilitation service for children with brain injury here in Temple Street. So the plan goes on, but we're under additional pressure to get the plan done, I suppose, because of coronavirus.
Yeah, and you've kind of answered this for me, Dr. Gill, but COVID came on top of a neurological service, a neurological care service in Ireland that was already under huge pressure. What are your thoughts for the implications now, on top of, as I say, on top of COVID-19? What are the implications over the next while in terms of resourcing of services?
Well, I suppose one of the interesting things, if I was to take a glass half full approach to coronavirus, is that I think people have increasingly seen that there is a rehabilitation element to managing particularly the adult caseload. So we've seen people survive ICU and come out, but need a lot of rehabilitation to get back on their feet again and back to doing the things that they want. And I think it's opened the public's eyes to the importance of that kind of a functional approach, rather than focusing all about diagnosis and medical care, rather going right back to people and ask, well, what's important to you in your life and how can we help you do those things, which is the very essence of rehabilitation. It goes back to patient-centered care and the things that people value, I suppose. And I think coronavirus has in a way, has actually demonstrated that approach to health is a modern way to look at these things, and something that people can see as being applicable to them. What I hope happens is that we, I suppose, if the previous habit was that disability was in a separate category, and that people with disabilities were in a separate category, that may no longer be the case. That's I suppose a reasonably big dream, but I suppose the idea is that coronavirus has shown us that anyone can experience disability, and people who've had coronavirus experience it for a while and then get better. But I suppose if those people are entitled to good rehabilitation, well, then I don't think we can stand over a situation whereby people with chronic disabilities are entitled to less. And the experience of people with chronic disabilities, and this is children and adults alike, is that the services are difficult to access in many parts of the country, not necessarily anywhere. There's lots of good work being done by lots of good people, but I think most people would agree that we are short-staffed and short-serviced, and that getting into these services is a challenge. We're certainly, speaking from my own specialty, we're massively under-resourced in terms of rehabilitation. There's no question that my adult colleagues likewise are at somewhere, depending on which country you aim at, they're either at a third or an eighth of the numbers that they need to look after the needs in Ireland, and it's even worse for kids. So what I hope is that the powers that be and the people with the purse strings will be more responsive to I suppose the advocacy of people like me and other HSCPs and doctors working in disability and rehabilitation, that when we say that this kind of care matters and that it's under-resourced, that they're receptive to that message, and that they know that there are needs that are not met and that it's important that they are met. So that would be my hope, but it remains to be seen how that goes.
Dr. Gill, thank you so much for talking to me today. Thank you very much.